It's a partnership, a virtual partnership, if you like, of the health services both in the border corridor of Northern Ireland, that's the Western Trust, and the Southern Trust, where we reside at the moment, and Dublin North East HSE and HSE West. And we have a partnership with the Health and Social Care Board in Northern Ireland and the Public Health Agency. And CAWT is actually an organisation which is 20 years old. But in case people think it's very different than the ordinary health services, my contract, for example, has always been with the health service in Northern Ireland. Many of my colleagues have contracts with the HSE. So it's not an individual organisation, it is simply a coming together of like-minded people who want, for very good reasons, to work together in a collaborative way, north, south, all island, wherever it makes sense to do these things with health. And I think you'll agree, in a very sparsely populated area such as we're in at the moment, we can't afford to duplicate services. We can't afford not to take advantage of economies of scale. So we were very, very fortunate in that the two departments of health asked CAWT to become the delivery agent on a €30 million project. It's one project that's divided into 12 strands, and because of the shortness of time tonight, we can only really talk about acute. But there are 11 other very substantive projects. The acute project is worth €9 million, and this particular area has benefited very much from that work, and Linda will tell you a wee bit more about that. But I think everybody knows, the further you are away from the seat of government, whether that's Belfast or Dublin, the poorer your access to services is, particularly to health service. Where I live on the border of Donegal and Fermanagh, for example, there are no trains. The infrastructure is very, very poor. There's a very elderly population. So we've got all of that peripherality to deal with. So hopefully Linda will give you a wee bit more detail around acute, but just to say that as well as the day-to-day work that we do for Europe, we also do commission projects for the department. So if I have time, I will answer questions on that.
Thank you. Just following on really from what Bernie has said, I'm the acute programme manager, and just a very quick snapshot of the projects that I manage are ENT, vascular, urology, ophthalmology and oromaxillofacial. And basically ENT project is very much centred in HSE Dublin North East, which is Cavan, Monaghan and Louth, and the Southern Trust, which is Craigavon, Daisy Hill and South Tyrone and Dungannon. We started off in 2009 with about 4,000 patients waiting in the Cavan, Monaghan, Louth area, waiting on their first ENT outpatient appointment. Now we've started our service up in Monaghan with the consultants travelling from the Southern Trust, so that they deliver a very local service of outpatients and day surgery there. We're just in the process of putting in some financial funding to put into a new modular theatre here in Daisy Hill Hospital in Newry. That will help support the ENT service, because the patients that need an inpatient stay either go to Craigavon or Daisy Hill. So we're actually building a service there that wasn't there before. We also have, obviously when the European funding, and as Bernie has mentioned, we're funded until 2014, we've already had commitment from HSE Dublin North East to continue the service of ENT. So that service will not fail. That service will be, really rock steady, because you don't want to build up a service and have public expectation and then have to withdraw it. So we've worked very, very closely with the partners in HSE Dublin North East. Vascular, I'll just mention very quickly, but it's mainly based in the Aaron Hospital in Enniskillen, and we do some vascular procedures, and obviously it's going to help the new acute hospital in that region. Our urology services then are mainly based in Donegal in Letterkenny Hospital, where we had started with one urologist working in Letterkenny. We're just about to go out now for another urologist and a full team of support services. They will also, our urology patients have a direct link, if they have a cancer diagnosis, they often need radiotherapy, and the new centre, which is going to be in Derry, will link very closely with that urology service. Ophthalmology, we are working very closely at the moment in Louth County Hospital in Dundalk, because most of the patients in the Cavan, Monaghan and Louth area are having to travel at this minute in time to Dublin, normally to the Mater Hospital. So we're developing a new service in Louth County and in Cavan, and we're about to appoint 2 consultants. And our last project then is Oral Max, which will also be delivered locally here in Newry, where children in the areas of Cavan, Monaghan and Louth will be able to avail of the service. Currently there's about a year's waiting list. The other interesting thing, we've recently been asked to join the Northern Peripheries programme, which is another European funded project, and that's looking at recruiting and retaining staff, particularly in border regions, and where it's difficult, as Bernie has said, staff often will congregate in the Greater Belfast area or Dublin or Cork or Limerick in the bigger centres, but they won't come out to the smaller hospitals. So we're doing some interesting work in that. Thank you very much.